The vaccines are rolling out and the rate of protection against the virus is steadily on the rise, but there's one big question remaining. Can you still transmit COVID-19 once you've been vaccinated? Well, everything is so new in this area that the answer isn't quite clear yet. But here's what the science is telling us so far. First, let's just recap how the vaccines work. The vaccines create special proteins inside our bodies. If you catch coronavirus, those antibodies latch onto the spikes on the virus, preventing it from gaining access to our healthy cells and causing an infection. But does stopping the virus inside our own bodies also stop us passing it on to others? The answer might be found in Israel. The country has been strong on maintaining social distancing and other health measures, but they're also leading the world in the rollout of the vaccine. It's now clear that full immunity is being achieved in 86% of people who've had the vaccine. In these cases, the virus is completely coated with those proteins and neutralised, so it can't enter our healthy cells. The virus particles quickly die inside the body and can't be passed on. That's all resulted in a 49% drop in cases since vaccinations began in Israel in December. So that's great news. But if only 86% of people vaccinated are getting immunity, that means 14% are not. How's that possible? Well, occasionally a virus cell can slip past the goalie. Let's go back inside the body to see what's taking place. When you're vaccinated, most of the virus particles are coated with those proteins and neutralised, but a few aren't. A few make it through to cause an infection. They get inside our cells and replicate. When those new virus particles begin their own hunt around the body, the antibodies get another shot. This time, the vaccine succeeds. That's called effective immunity. The gold standard, though, is sterilising immunity. That's when a vaccination can prevent an infection entirely, every time. The measles vaccine does this, as does the hepatitis vaccine, but they are in the minority. It's very hard to achieve, and at the moment there isn't enough evidence to suggest the COVID vaccines will do this. One of the main reasons for this is to do with where the vaccines are working in our systems. COVID-19 attaches to a protein in our bodies called the angiotensin converting enzyme. That protein is found in two places, the upper respiratory tract and the lower respiratory tract. The current vaccines have only been proven to reduce the virus in the lower respiratory tract. That's a good thing because that's where most of the serious symptoms occur. But the vaccines don't currently have a measurable effect in the upper respiratory tract, specifically our noses and throats. The good news is we don't necessarily need to achieve sterilising immunity to stop COVID-19 in its tracks. We've been in this situation before. This vision from the 1950s shows the residents of Hull in the UK lining up for the polio vaccine.
By noon of the first day, 150,000 people had been vaccinated. Supplies of the vaccine were quickly running out.
And while the polio vaccine doesn't achieve sterilising immunity either, enough people got that vaccine to slow the spread and reduced the severity of disease to a point where it could be brought under control. Just like then, the COVID-19 vaccines rely on enough of us getting the shot to protect ourselves and each other.